2. Blinky blink, Harlem World. 1 2 1 2. 1 2 1 2.
Meet Dr. Corey Black, dentist, CEO, and mastermind behind SmileSpace, a luxury dental practice with locations in Brooklyn and Harlem.
This practice could be anywhere. This practice could be in Soho and do well.
Traveling the world during his studies, he saw firsthand the daily negotiations people make when it comes to their livelihood and healthcare.
It's been super important for me to be here with the people and to provide those services to our people who look like me.
SmileSpace is remixing the narrative around who can have $1 million healthy smile with top-tier service.
People will walk by. They'll assume that we don't accept their insurance. They'll assume that we are fee-for-service, that they'll have to pay out of pocket, that we're expensive. But the reality is when they walk in, they see that we accept most private insurances and we're really here to serve them. What I've realized in my personal experience going to the dentist is sometimes it's overstimulating. Even the lights, the super bright lights. I've intentionally thought about every detail of the patient experience. We have Hulu, HBO, Amazon, Prime Video. The reality is a lot of people have dental anxiety. It's a real thing.
His dental studio feels more like a day spa.
Play 90s R&B. It's a vibe. We've created a vibe here.
With the leading dental practice in Brooklyn and a keen eye for trends, one dental trend has been hard to miss.
Better watch out what you eat or you gon' chip your new veneers. You used to grind your teeth, now you just grinding your veneers.
And so I've done veneer cases in the past. I've done a good amount of veneer cases, but I'd say there's been a significant increase in the number of people that are interested now.
Dr. Black has been performing way more veneer placements, which are meant to improve the appearance of the teeth by altering the shape, size, and color.
I think really because of social media, celebrities. I think most people on social media have seen at least one of their celebrity crushes with veneers.
He's also noticed a lot of misconceptions and misinformation about what it takes to get and maintain these pearly whites.
People don't really understand what veneers are, so I'll break it down to you. So there are two different types of veneers. You have composite veneers. We pretty much use like a filling material and we bond it to the outer surfaces of the teeth. The benefit to that is we don't necessarily have to shave down any natural tooth structure. We don't have to remove any natural tooth structure. So that is very appealing to people, but the downside is often the composite veneers look very big, bulky, like chiclets. The other type of veneer is a porcelain veneer. Porcelain veneers tend to be a little bit more expensive, but the benefit is that porcelain typically doesn't stain. It's a harder material, so it doesn't chip as often. And we have to remove a little bit of your enamel, but the truth is, in doing that, the teeth actually look more normal.
Like with many trends, people have found workarounds to get the look for less, traveling out of the country for the procedure or using an uncertified technician.
I guess the conversations weren't really had about maintenance and hygiene and prevention of cavities. And so I've had a few patients that have actually developed decay underneath those veneers.
Dr. Black recommends patients with veneers visit their dentist even more than those without, every 3 to 6 months.
People don't understand that as well, right? There's actually still natural tooth structure underneath that material. You can actually die from an infection in the mouth.
And there's other options like braces, Invisalign, even gum line contouring. Veneers definitely aren't for everyone, but Dr. Black welcomes the new engagement around having a healthy smile.
The reality is you have your natural tooth structure that looks just as good as veneers, and it's all yours.